Hello and welcome to my channel. In this lecture we're going to talk about the flexor compartment or the anterior antebrachial muscles. So let's begin. The antebrachial muscles means the forearm muscles. The arm is the brachium, the forearm is the antebrachium. The muscles are divided into anterior, lateral, and posterior groups. Some books divide them into anterior group and posterior group, no lateral group. The anterior group divided into superficial group, middle muscle, one muscle, which is the flexor digitorum superficialis, because it's at a slightly deeper level than the rest of the muscles of the superficial group, and a deep group attached to the radius and ulna. Okay, the superficial group mostly attached to the humerus. The superficial flexor group attached to medial epicondyle. It's called the common flexor origin or the common flexor tendon. They are composed of the pronator teres, the flexor carpi radialis, the palmaris longus, flexor digitorum superficialis, and flexor carpi ulnaris. If you want to learn them by heart, put the the base of your left hand on the medial epicondyle of your right arm, and the thumb will represent the pronator teres. The index finger will be the flexor carpi radialis, and so forth. Now the pronator teres muscle, this is the pronator teres muscle, arises by two heads, the humeral head from the common flexor origin and the ulnar head from the lateral side of the coronoid process. So the heads meet together and form the pronator teres muscle with the median nerve in between the two heads. It inserts at the summit of the radial convexity. We learned that before when studying the osteology. The pronator tubercle or pronator tuberosity on the summit of the radial convexity. The median nerve passes between the heads and separated from the ulnar artery by the ulnar head. The radial artery is superficial and the ulnar artery is deep, as you can see here. This is the radial artery and this is the ulnar artery. The ulnar artery is deep to the pronator teres muscle. Action of the muscle, pronation by its name, and the nerve supply by the median nerve. Now we must stick to details here. Median nerve means from the trunk of the median nerve, not from a branch from the medial nerve like the anterior interosseous, for example. The flexor carpi radialis muscle, arise from the common flexor origin, inserts at the base of the second and third metacarpal bones, the flexor carpi radialis. So expect the insertion of the extensor muscles, the extensor carpi radialis, longus and brevis, to be also at the basis of the second and third metacarpal bones. Okay? Action is flexion and abduction at the wrist, and the nerve supply by the median nerve. Palmaris longus muscle. This is the palmaris longus muscle. It's a small muscle with a long tendon. And by the way, it may be absent in some people. And the tendon is visible in the middle of the wrist when you tense your grip at just before the hand. You'll see the tendon bulging upwards. Arises from the common flexor tendon, inserts in the palmar aponeurosis after passing anterior to the flexor retinaculum, and the tendon of palmaris longus will cover the median nerve at the wrist. Okay. Flexor carpi ulnaris muscle, the flexor carpi ulnaris muscle, this muscle, also arises by two heads. humeral head from the common flexor origin, the ulnar head from the aponeurosis from olecranon and posterior border of the ulna. The aponeurosis that this muscle arises from, the aponeurosis here in this side, shares three muscles, shared by the flexor carpi ulnaris, extensor carpi ulnaris, and the flexor digitorum profundus. Remember that. The heads are connected by a fibrous arch for the passage of the ulnar nerve. Remember I told you every nerve that enters the forearm pierces a muscle. The ulnar nerve pierces the flexor carpi ulnaris. The muscle inserts in the pisiform bone. Tendon extends beyond the bone as pisometacarpal and pisohamate ligaments. So the pisiform is considered a sesamoid bone that grows inside the tendon. The action of the muscle is flexion and adduction at the wrist, and the nerve supply by the ulnar nerve. Now the middle muscle, which is the flexor digitorum superficialis muscle, arises also by two heads, the humeral head or the humero-ulnar head and the radial head. The humeral part of the humero-ulnar head from the common flexor origin. The ulnar head, this is the flexor digitorum superficialis. The ulnar head from the medial side of the coronoid, and the radial head from the anterior oblique line of the radius between the radial tuberosity and the pronator teres insertion. Okay, forms two sheaths. Now a superficial sheath for the index and little finger, for the middle and ring fingers, and a deep sheath for the index and little fingers. So they are four tendons stacked two by two. The two on top for the middle and ring fingers, and the two on the bottom is for the index and little fingers. And this is the arrangement in the carpal tunnel. This is the arrangement of the tendons in the carpal tunnel. The tendons split to allow for the passage of tendons of flexor digitorum profundus, unite, then resplit and attach to the sides of the middle phalanges of the medial four fingers. Medial four fingers, okay? Now remember, the medial four toes included the big toe, but here the medial four fingers, they exclude the thumb, okay? Because the anatomical position of the hand is supination. Okay. Median nerve is bound to its undersurface. If you are dissecting a forearm and you try looking for the median nerve, and you're handling the flexor digitorum superficialis in your hand, you will not be able to find it. Just flip the flexor digitorum superficialis, you will find the median nerve, sticking to its undersurface by connective tissue. The action flexes wrist, metacarpal phalangeal joints, and proximal interphalangeal joints. Why not the distal interphalangeal joints? Because it does not reach the distal phalanx, only for the middle phalanx. Expect the muscle that reaches the distal phalanx will flex the distal interphalangeal joint. The nerve supply by the median nerve. Okay. See here, just to show you the splitting of the tendon of flexor digitorum superficialis to allow for the passage of the tendon of flexor digitorum profundus. The deep flexor group, the flexor digitorum profundus muscle, arises from the anterior and medial aspect. This is the muscle. Arises from the anterior and medial aspects of the ulna, medial side of coronoid process, and aponeurosis shared by the flexor carpi ulnaris and extensor carpi ulnaris, as mentioned before, and from the interosseous membrane. It forms the bulk on the medial side of the forearm. The tendons to the medial four digits pass through the splitting of the flexor digitorum superficialis and insert in the distal phalanges. Okay? Together with the flexor digitorum superficialis are in the same flexor sheaths or the synovial sheath in the carpal tunnel. Action of the muscle: flexes the wrist, metacarpophalangeal and interphalangeal joints, the proximal and distal ones, and the tendons give origin to the lumbricals in the hand. Now, I did not talk about any sheaths, superficial and deep sheaths, like the flexor digitorum superficialis. The tendons are arranged beside each other, as you can see here. Okay, and this is also the arrangement in the carpal tunnel. See, these are the tendons of the flexor digitorum profundus, giving origin to the lumbricals and passing through the splitting of the flexor digitorum superficialis. Now, fibrous sheaths of the flexor tendons, the same like the foot, alternating fibers of transverse and X-shaped fibers, you can see that, forming tunnels for the tendons of the long flexor muscles, and the tendons are surrounded by synovial sheath inside the tunnel of the fibrous flexor sheath. Now, if you dissect the tunnel and the tendons, you will find them connected by what's so-called the vincula, longa and breva. They are extensions of the synovial membrane that carry minute blood vessels to the tendons. See, these are the vincula of the long flexor tendons. Okay. Flexor pollicis longus muscle. This is the flexor pollicis longus muscle. It's a unipennate muscle. You can see that. Unipennate muscle. Arise from the radius between radial tuberosity and pronator quadratus, attachment distally. Inserts in the distal phalanx of the thumb in a fibrous flexor sheath of its own. And vessels and nerve are medial to the muscle, between it and the flexor digitorum profundus muscle. The action is flexion of the phalanges of the pollix, the thumb. Nerve supply by the anterior interosseous nerve. Now you must mention the exact nerve supply, not only by the median nerve. The median nerve gives the anterior interosseous nerve, yes, but you must mention the precise branch, the precise nerve supply by the anterior interosseous nerve. The pronator quadratus muscle attaches to the anterior borders of the ulna and radius distally. It prevents separation of the distal ends of the radius and ulna in thrust or in pronation. And also it helps the pronator teres in its pronator action because it's a pronator muscle. The action, pronation, and the nerve supply by the anterior interosseous nerve. The anterior interosseous nerve actually ends in the muscle by supplying the muscle. See, this is the pronator quadratus muscle. It's the deepest muscle. Vessels, radial artery, branch of the brachial artery level with the neck of radius, superficial to pronator teres, as we mentioned before. Distally, it's covered by skin and fascia because it's not covered by brachyradialis anymore. It was covered by brachyradialis, then emerges from the brachyradialis and covered only by skin and fascia, where you can feel the pulse by pressing against the radius. Okay? Superficial branch of radial nerve is lateral. Now, doctors, please, the nerves in the forearm are on the outside and vessels are on the inside. Okay? Nerves on the outside and vessels on the inside. Branches of the radial artery, radial recurrent artery, passes between the superficial and deep branches of the radial nerve. This is the radial recurrent artery. See that? Covered by brachyradialis. It shares in the elbow anastomosis and gives muscular branches also, the radial artery, and ends by forming the deep palmar arch. The deep palmar arch formed by the radial artery. The ulnar artery arises level also with the neck of radius, lateral to the medial nerve. It crosses medially under the pronator teres. It's deep to the pronator teres, separated from the median nerve by the inferior head or deep head of the pronator teres, covered by flexor carpi ulnaris muscle and then skin and fascia. Also, it was covered by muscle and then emerged from the side of the tendon of the muscle, where you can feel also the pulse, but not as clear as the radial artery. The ulnar nerve medial to it, and the palmar cutaneous nerve is with it. The palmar cutaneous nerve with it. Has venae comitatus with it and passes superficial to flexor retinaculum, not in the carpal tunnel, superficial to the flexor retinaculum, lateral to the pisiform and ulnar nerve, ends by becoming the superficial palmar arch. So the radial artery formed the deep palmar arch. This one, the ulnar, will form the superficial palmar arch. Now, see, this is the superficial palmar arch. This is the deep palmar arch. Now, how do you extinguish between both in X-rays, in arteriographies? The deep palmar arch level with the bases of metacarpals, while the superficial palmar arch base with the shafts, mid shafts of the metacarpals. See, this is how you distinguish between the two arches. Branches of the ulnar artery: anterior ulnar recurrent artery, anterior ulnar recurrent artery, posterior ulnar recurrent arteries, and they share in the elbow anastomosis, pass between the heads of flexor carpi ulnaris, the posterior one, with the ulnar nerve. See, this is the anterior ulnar recurrent, and this is the posterior ulnar recurrent. The common interosseous artery, a short artery that almost immediately divides into anterior and posterior interosseous arteries. Sometimes the anterior and posterior interosseous arteries come individually from the ulnar artery. The anterior interosseous artery, the one we're concerned with because we are in the flexor compartment, is on the interosseous membrane between the flexor digitorum profundus and the flexor pollices longus. Also, the artery lower down pierces proximal to the pronator quadratus, pierces the interosseous membrane to anastomose with the posterior interosseous artery on the back of the interosseous membrane. Okay? Now for the veins, we have cephalic vein and basilic veins. The cephalic vein is the lateral one, the basilic vein is the medial one. Of course, they are all part of a network of veins that covers the upper limb. They come from the dorsal venous arch, the same like what happens in the foot, and communicate by cubital veins, the site for injections in the roof of the cubital fossa. Deep and superficial palmar venous arches that correlate with the deep and superficial palmar arches drain into the radial and ulnar venae comitatus that accompany the radial and ulnar. Lymphatics with the veins, okay? And remember that on the medial side, the lymphatics to the supratrochlear lymph nodes, then to axillary, and the rest of the arm with the cephalic to the axillary lymph nodes along the course of the cephalic vein. The nerves, we have the lateral cutaneous nerve of the forearm, which is continuation of musculocutaneous. After it supplies the brachialis and the biceps, emerges laterally to become the lateral cutaneous nerve of the forearm. The ulnar nerve, medial to the ulnar artery under the flexor carpi ulnaris, passes to the hand over the flexor retinaculum, lateral to the pisiform and grooves it. So which structure that grooves the pisiform bone, the ulnar nerve or the artery? It is the ulnar nerve. You can't put the artery right next to the bone because it's pulsating. You know, you must give room for the artery to pulsate. Branches of the ulnar nerve: medial half of the flexor digitorum profundus. Okay. The flexor carpi ulnaris. And did we forget to mention the nerve supply of the flexor digitorum profundus? It's dual nerve supply. From the anterior interosseous nerve and the medial half from the ulnar nerve. I apologize about that. So the medial half of the flexor digitorum profundus, the slips that are going to the ring and little fingers, okay, and this explains the deformity in the ulnar claw hand. In the ulnar claw hand, ulnar nerve injury, there will be deformed ring and little fingers because the part of the muscle that goes to these fingers is paralyzed, which is the medial half of the flexor digitorum profundus. The flexor carpi ulnaris gives a palmar cutaneous branch in the middle of the forearm on the ulnar artery, in the middle of the forearm, not the arm, and the dorsal cutaneous branch right before the wrist. It goes back to the dorsum of the hand to supply the these supply the dorsum and palm of the hand, not the fingers. The fingers are supplied by the terminal branches of the nerves. Okay, so you must differentiate between that. The palmar and dorsal cutaneous branches, they supply the corresponding parts of the palm and dorsum of the hand without the fingers. The fingers are supplied with the terminal branches of the nerve, and also give articular branches. The radial nerve, anterior to the lateral epicondyle, as we mentioned before, we are following its course since its origin from the posterior cord of the brachial plexus in the groove on the back of the humerus, and then anterior to the lateral epicondyle, where it divides into a superficial and deep branch. Now, the superficial branch will go under the brachioradialis muscle and will end up crossing to the dorsum of the hand over the anatomical snuff box. And you can feel the branches of the superficial branch of the radial by rolling your fingers on the tendons at the base of the thumb. When you extend the thumb, the tendons will bulge. You can roll your fingers on these tendons. You will feel the branches of the superficial branch of the radial nerve. So it's a sensory nerve. The deep branch of the radial nerve passes between the heads of supinator, or pierces the supinator, and becomes the posterior interosseous nerve. It's the main nerve to supply the extensor compartment of the forearm. But before becoming the posterior interosseous, it supplies the supinator and extensor carpi radialis brevis. Please, they stress on these info in the exams. So the deep branch of the radial nerve supplies the supinator and extensor carpi radialis brevis. The posterior interosseous nerve supplies the rest of the muscles, the extensor muscles. Don't confuse this with the, don't just say radial nerve, and don't confuse the deep branch with the posterior interosseous branch. Also gives articular branches. This concludes our talk about the flexor compartment of the forearm. I hope you got the maximum benefit from this lecture, and thank you very much for watching.